The evaluations with mTOR inhibitors, which can block PTEN and downstream pathways from PTEN, have been fairly mixed, but they do appear to be active. At least 2 trials suggest the activity of PTEN, of mTOR inhibitors is going to be seen in patients who are less pre-treated. So in the National Cancer Institute of Canada studies, there was a higher response rate for patients who had no prior chemotherapy, and it fell to single digits, so it went from 25 to 9% when the population under study had prior chemotherapy. But beyond that, the whole notion of can we exploit PTEN inhibition, can we exploit mTOR inhibitors in a better fashion, that's really the critical question. We were hoping that we could identify a population based on PTEN mutation that would benefit from treatment, and hence do an enriched study in that population, really determine in people who should benefit from inhibition of mTOR, what's the response rate, what's the stable disease rate, how many women are deriving clinical benefit. It hasn't worked out that way. So when we look at completed trials, and we try to look at PTEN mutations or even other mutations along the same pathway and see if they are prognostic in any way at all for responses, for stable disease, for progression-free survival, none of them appear to be prognostic. So at this point, we're still trying to identify populations who we should get mTORs and try to do these enriched studies where we can identify the real and true signal and the benefits of blocking that signal with mTOR inhibitors.